Spotting is light vaginal bleeding that happens outside of your regular menstrual period. It's not enough flow to fill a pad or tampon. A period, or menstruation, is the regular cyclical shedding of the uterine lining. It's characterized by a predictable flow that's heavy enough to require the use of menstrual products like pads or tampons. Now, how can you tell them apart? There are four key factors. First, look at the flow and volume. Spotting is a very light flow, often just a few drops or pink or brown discharge you see on toilet paper. It does not require a pad. A period, however, has a consistent flow of fresh red blood that is heavy enough to require a pad, tampon, or menstrual cup. Second, consider the duration and timing. Spotting is brief, lasting from a few hours up to 2 days, and it can occur at any point in your cycle, like during ovulation or implantation. A period typically lasts between 3 to 7 days and follows a predictable cycle, usually every 21 to 35 days. Third, pay attention to the associated symptoms. Spotting usually comes with no symptoms or only very mild ones. A period is often accompanied by cramps, bloating, breast tenderness, mood swings, and lower back pain. Fourth, observe the blood color. With spotting, the blood is often pink because it's mixed with cervical fluid, or it's brown or dark, indicating it's old blood. With a period, the blood is typically bright to dark red. What are the common causes of spotting? It can be caused by ovulation due to a mid-cycle dip in estrogen, or by implantation bleeding about 6 to 12 days after conception. Hormonal contraceptives like pills, intrauterine devices, or implants often cause spotting, especially in the first 3 months of use. It can also be a sign of pregnancy complications like an ectopic pregnancy or miscarriage, or of conditions like uterine or cervical polyps, fibroids, or infections such as pelvic inflammatory disease. Perimenopause is another common cause. Finally, know when to see a doctor. You should schedule a visit if you experience spotting that persists for more than a few cycles, any heavy bleeding or spotting after confirmed menopause, or bleeding that's accompanied by severe pain, fever, or dizziness. Also, see a doctor for any postcoital bleeding, or if you suspect you might be pregnant. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.